Hi everyone, my name is Sarah Santiago. I'm one of the fourth year residents. I'm really excited to talk a little bit more about our amazing program here at the University of Michigan. But first off, welcome to the interview trail and congrats on making it this far in your journey. You guys should all be so proud of yourselves. We, as residents, wanted to give you a brief overview of our program as far as things that we think are important when choosing a program. So I'll go through this slide first and then these slides first, and then we can break out into small groups. We'll have some residents in each group so that you can ask any questions, any last minute burning questions that you might have, and hopefully we can get to know you a little bit better. This is very casual, so please eat, drink, do what you gotta do while we're going through all of this. So one of the most important things, I think, when choosing a residency program is figuring out who are the people that you're going to be working with day in and day out. At any residency program that you go to, if it's an academic program, you're going to get really awesome training no matter what. The volume is going to be there, the clinical exposure is going to be there. But what it comes down to is who are you going to be leaning on when times get rough? Who are you going to turn to when you've got a really, really busy day and you feel like you're drowning? I feel very grateful with all of the amazing friends that I have made here in residency and would not change it for the world. So really look out for some people who you feel like you bond with, you mesh with, and you feel like you could see yourself working with for the next 4 years. So here are all of our classes, all of my co-residents, people I am so incredibly proud of. It is amazing in residency to see how much people grow throughout the next 4 years of your career. We are friends, we are advocates, we are surgeons. A lot of us are partners in crime in both research and education. A lot of us have children, and some of us are pregnant. But ultimately, we are leaders in best, and we try our best to support each other day in and day out. Another really important thing to look out for when choosing a residency program is knowing what their core values are, and do they align with yours? So here at the University of Michigan, we're all about the team, which means if you are on the GYN pager and you're drowning in consults, you can reach out to some of your co-residents and we will be there to support you, whatever is best to help you provide the best care to patients. And that goes for our faculty members as well. I feel very comfortable reaching out to our faculty members and saying, hey, I need your help. Can you help me with this? And know that they are always willing to help out. Second, our other core value is excellence, which means providing the best care that we can for our patients. And that includes doing the research needed to help provide that best treatment for them. We are very grateful here at the University of Michigan that we have so many faculty members on national boards, committees, societies, and so we have that support in all of those fields. We also value inclusivity. We have a whole committee dedicated to this, both for our patients, our faculty, our residents, recruitment, and research. I think this is really important as far as having residents with multiple different backgrounds. So share your story. We want to know you and get to know you better. All right, so here are some highlights of the PGY1 schedule. So you get early surgical exposure, early subspecialty exposure, and you get to do C-sections from day one. For the year, you do 8 weeks on L&D, 8 weeks on L&D nights, 8 weeks on GYNOC, 8 weeks of OB clinics, so that includes high-risk OB exposure. But we also do our L&D triage during that month. We work in the fetal diagnostic center with the high-risk OB doctors, so we practice doing ultrasounds really early on because it's a very important skill to have. And then we do 5 to 6 weeks of GYN clinics, and that's where we get exposure to those subspecialties super early on. We rotate with family planning, Urogyn, we go to Planned Parenthood, adolescent gynecology, transgender clinic, the breast and cancer genetics clinic, we have a vulvar diseases clinic, we have a pediatric adolescent gynecology clinic, and a colposcopy clinic, just to name a few. We have so many subspecialties here at the University of Michigan. Honestly, all of them, plus some that aren't actually ACGME accredited. And so if you have a niche, we probably have it. And then lastly, we have a 6 to 8 weeks of benign gyn. So I'll breeze through the PGY 2, 3, and 4 schedules here a little bit quickly. So just know that your second year, you're doing a little bit more operating. We have a whole C-section service where day to day you are just doing C-sections. You get early exposure to MIS or UroGYN, so doing more complex cases like vaginal hysterectomies or laparoscopic hysterectomies. There's a month of an elective for your second year, where typically people do step 3. For your third year, this is your first year being chief of a service, your OB night chief, as well as gyn-onc chief. We do have a rotation in Midland, which is a community hospital. That's where we do a lot of our robotic surgery. And there's also an elective month that year, so some residents choose to do either research, or if you have an interest in global health, a couple of our residents have gone to Ghana and done some work out there. Lastly, our PGY 4 rotations is sort of more of the same, but you're the chief of the service, you're making the schedule, and you're just really honing in on your skills and solidifying them. All right, let's talk about vacations. This is a very important topic that you want to make sure you ask about at all of your interviews. We are very lucky here. We get 4 weeks of vacation, but it's really like 5.5, because this does not include holidays. And you get a week for Christmas or a week for New Year's, depending on what your preference is and what the other residents prefer as well. And it also does not include the 4th of July or Thanksgiving or Labor Day. That gets added into the call pool. Your vacations will be taken in either 1 or 2 block chunks, so totally your preference when you want to do them and how long you want them to be. All right, so another important thing to ask is the call schedule. We have 4 call shift blocks, and that is Friday night, Saturday day, Saturday night, and Sunday day. And so this is either for GYN or OB call, and you take gyn-onc call when you're on gyn-onc, and so when you're on gyn-onc, you don't have to worry about OB or benign gyn. If you are on a Friday night and you are working during the day, that is a 24-hour shift, and so you get the rest of the weekend off. And the call schedule gets requested in 4-month blocks, so you know 4 months in advance, when am I going to be on call? Your call will be assigned by the admin chiefs, but you can trade call with co-residents if needed, and a lot of this is based on a request basis. So if you know that you're going to a wedding, or you have vacation, or you want to go see family, just tell the admin chiefs which weekend blocks you want off, and they will do their best to make sure that happens. All right, we want to show you just a sample call schedule. So as you can see on the left, so these are our PGY 3s. On the right are our PGY 4s. And on the first column, so Dr. Louie was on gyn-onc, so she is not added to the call pool for LND and GYN. Another thing I want to point out is on that second weekend, all of the PGY 3s have that weekend off. This can be requested by your class if you guys want to take a little getaway for the weekend so that you can do a class trip. It is so much fun. We highly recommend it to all of our classes. It's just really great for bonding. My class has gone to Traverse City twice. We've gone to Chicago once, and maybe we'll be going to Toronto for the next one. Who knows? We'll see. So as you go along the trail, you're going to find that a lot of the programs sound the same. And unfortunately, because all of our interviews are virtual, you can't see the program, you can't see the hospital or the city. So we want to share a little bit about some unique aspects of our program. Here at the University of Michigan, we are unionized under the House Officer Association. So technically we are called house officers and not residents, but we use it interchangeably. So this provides us with a lot of benefits. The main one being our higher pay. I don't have this on the slides, and I know that Dr. Marzano and Dr. Fenner are probably going to go into a little bit more detail about all of this on your presentation for tomorrow, but just so you know, HO1s make $70,000, HO2s make $72,000, HO3s $75,000, and by your 4th year, you are making $78,000 per year. So not bad. Other things, so if you work on your birthday, you get, I believe it's an extra $300 just for working on your birthday. And there is a holiday bonus, which I don't know if I'm allowed to disclose how much, but it is a nice chunk of cash, so that is great. We have access to free mental health services. You know, as OBGYN residents, we see a lot and we work really, really hard day in and day out. Things can be quite stressful, so it's important that we value our mental health and our wellness. And so it's really nice to have access to this. They work with your schedule. They know you're a resident. They know you have crazy hours. And so that is super convenient for our residents. And then there are some photos here of our house officer lounge, which is just for our residents. There's a bunch of computers so you can do some charting while you're there. There's a TV that is like always playing sports. There's a coffee machine, a tea, like a hot water and tea machine. There's this lovely, where Liz is photoed here, there's a massage chair, which is super comfortable if you want just a little getaway and a little massage and break away from work. And then in that left side, there is a lactation room. So if you are breastfeeding, you've got some privacy there. And then I believe there is a notary in the house officer lounge as well. We have 2 very large simulation centers here at the University of Michigan. We have access to laparoscopic trainers as well as robotic trainers. Here in the center, I'm delivering a baby on our Noel trainer, which is really great for labor practice, shoulder dystocia practice. We've got hysteroscopic trainers, colposcopy trainers. We have access to a cadaver lab, so if we wanted to practice doing cystotomy repairs or 3rd and 4th degree repairs, we also have access to that too. We also get to work very closely with midwives on our labor and delivery service. We have a laborist who is a midwife who is there every single night and every single day, and they work really closely with the interns. They teach us normal labor. They teach us different position changes that will help your baby flip. And there's Sarah McGuire, one of our amazing midwives in the center, who is teaching us optimal fetal positioning, and gravity is a laboring woman's friend. She's amazing, such a great teacher. We have so much to learn from them. And not only do we just learn from them and hang out with them at work, we also hang out with them outside of work. And so as you can see on the right, some of our residents hanging out with our amazing midwives. All right, so some of you might be thinking, this program sounds great, but what's there to do in Ann Arbor? Well, let me tell you, stay tuned. We have breweries galore here in Ann Arbor, and so if you are a beer drinker, you like IPAs or draft beer, there is probably a brewery for you here. It's a lot of fun to grab a drink after work, unwind with your co-residents, and debrief about the crazy days that you've had. It's just a lot of fun. So one great thing that we can do here in Ann Arbor. Next up, we have floating down the river. If you've never floated down a river before, it is so much fun. We have the Huron River running through Ann Arbor. It is gorgeous. It runs really close to the hospital too, so you pass it along the way as you're floating down the river. We do this every single year when our interns match, but I've gone a couple of times with my partner and I've gone with my dog before. It's a lot of fun. All right, this one goes without saying, but the Michigan team is so good. They are so strong this year, and it makes it a lot of fun to live here because you get to be around that atmosphere. We love to tailgate, but just know that if you do come here for residency, you are going to drink the blue Kool-Aid and you will also be obsessed. Ann Arbor has some gorgeous hiking trails as well as biking trails. It's a very bike-friendly town, which is super convenient if that's something that you enjoy doing. There's fishing. If you like fishing, you can go kayaking. There's a rock climbing club. So lots of fun activities outside of work if you're someone who's pretty outdoorsy. Another great perk of living in Ann Arbor is that Detroit is not that far away. It's a 40-minute drive. The food out there is amazing. If you are someone who's a foodie like me, there's really great options out there. The airport is close by. It's also in Detroit. So again, really quick and easy to get to the airport. So for vacations, if you have a long distance relationship, if your family is far away, having that airport nearby is so nice. Okay, so this video is going to be a tour of the Mott Hospital. We have 2 main hospitals and they're connected. So there's the Women and Children's Hospital, or Mott, and then there's also our main hospital, and that's where we primarily see our patients. L&D is going to be at the Mott Women and Children's Hospital, and some of our gynecologic patients will be in the main hospital. So typically, gyn-onc, all of our adult ED consults are in the main hospital.